Good morning, everyone, and thank you very much for inviting myself and Larry here this morning to talk to you about patient and public involvement in my PhD, the impact of the COVID-19 pandemic on ambulance response times for suspected stroke and transient ischemic attack in Ireland. So just to go through an overview of what we will be covering this morning. So firstly, I'm just going to give you a broad overview of what my PhD project actually involves. Then I'm going to specifically discuss the PPI elements, so the who, the what, the where, the when, and the why. Then some tips and learnings I've picked up over the last kind of year and a half of actually incorporating PPI into my PhD project. And then I'm going to pass you over to Larry, who will discuss his experiences as a stroke survivor. So firstly, my project will have 4 studies. The first is a systematic review, which will be looking at the international evidence on the impact of COVID-19 on pre-hospital care for those with stroke and TIA. Then we will be looking at trends in Ireland for ambulance response times before the COVID-19 pandemic and during the pandemic for those with stroke and TIA. Then hopefully this study will be scaled up to become an international comparative study where we will be comparing those figures for Ireland against other studies with the same ambulance prioritization systems. And then finally, we will be doing an interview study with both primary and secondary care physicians and other members of the MDT from urban and rural areas about the impact of COVID on ambulance response times for those with stroke and TIA. And the reason we're here today, PPI has an integral part in this project from the beginning, with the whole direction of the project, the development of the research questions, and will continue to do so throughout the 4-year project. So now we're going to get into more specifics on the PPI used in my PhD. So the who, the what, the where, the when, and the why. So firstly, the who. So I'm lucky enough to work with 2 excellent panels of PPI contributors. So one here you can see is an existing stroke support group based in Cork. Then the other is a panel of 12 PPI contributors who myself and my colleague have worked with from the very beginning of our projects and who we started putting together in July of last year. So this panel comprises of stroke survivors, those who had a TIA, and those with risk factors for stroke, and also their carers and family members. How did we actually recruit these PPI contributors to our panel? So really, this was an extensive process, which was both pragmatic and carefully planned. So social media really helped us in this regard. For example, Twitter is how I actually got in contact originally with Larry himself. And we put up posts in Facebook groups. There was an email sent to all UCC staff. I got in contact with specific stroke groups like the Cork Stroke Support Group and other stroke-based organizations like the Irish Heart Foundation. And then also, of course, PPI Ignite, both in UCC and in NUIG, really helped to support us through this journey by retweeting posts on Twitter and other means. So I think this slide is potentially the most important slide I'm going to present to you this morning. And a few weeks ago, I asked members of the PPI panel to explain why PPI is important to them and why they became involved in PPI from the outset. And I think this slide really sums up the meaning of PPI and why PPI is in my PhD a lot more than I could this morning in my own words. So really, PPI contributors want to make a difference. They want to have their priorities heard, and they want other stroke survivors to learn from their journeys and also to have better care as a result of their own individual stroke journeys. The when and the what are intertwined in this project. So I just want to give you an example of how PPI really shaped my PhD topic. So originally I was going to look more generally at the impact of the COVID-19 pandemic on acute stroke and TIA care in Ireland. Then I spoke to both of the PPI panels, and all of the stroke survivors explained to me that that period from onset of stroke symptoms to actually getting to hospital was one of the most important parts of the stroke journey in their opinion. So for that reason, and for a few other practical reasons, my project has now become the impact of the pandemic on ambulance response times for suspected stroke and TIA. So that time from getting symptoms of a stroke to getting to hospital. So now I'm just going to briefly go through each study and give you some information on the PPI that either has been incorporated or will be incorporated into the study in the future. So for the systematic review, I worked with the members of the Cork Stroke Support Group, and we basically had a conversation about possible words they would use to describe stroke, so maybe more colloquial terms they'd use in their day-to-day language. Then I was talking to them about how they would like to be referred to throughout this study, and stroke survivor was the most popular term. And then finally, what priorities would they have in terms of pre-hospital care for those with stroke, and who should I talk to as part of this study? Then for the National Temporal Trend Study, I talked to the group about what's important to them to know about the potential impact of COVID on pre-hospital care for those with stroke. What would they like to know about the people who had a stroke or TIA before and during the pandemic? Who do they think needs to know about the results of this study? Is it only healthcare professionals? Is it healthcare professionals, policymakers, and also most importantly, the people who it affects the most, stroke survivors and their families? And also, how do they think would be the best way of getting the results of this study out there? Then I am yet to start work properly on the international comparative study, but what I envisage to happen is that the PPI contributors will be involved in interpreting the results. So what do the results of this study mean to them? Then is there anything else they would like to know? Is there something I missed? Is there something that we didn't look at in depth enough? And how could this maybe go on to result in the next study or to inform the next study that I'm planning to undertake? And then finally, so the qualitative study, so the interview study with healthcare professionals. Again, I have not yet started work on this, but I envisage the PPI will take the form of who should be involved in the study. So who do the PPI contributors think we should be targeting? What kinds of healthcare professionals? What kind of questions should we be asking? And how should we be actually reaching out to these people and getting them involved in the study? So before I hand over to Larry, I'm just going to give you a few tips and tricks that I've accumulated over the past year and a half of engaging with PPI. So firstly, if possible, I would recommend you collaborate with another colleague in your department. So I was lucky enough to have a colleague who has a similar PhD topic to my own. And so we worked together to create this PPI panel. Start as early as you can in your PhD. I started in kind of the middle to the end of first year, and it really paid off in terms of really meaningful PPI that actually, as I showed you earlier in the presentation, really helped to shape my project and make it meaningful and worthwhile for those it affects the most. Be organized, have a plan for what you'd like your PPI to entail, where we'll be involved, which studies will be involved in, how early you'll begin. Then from a conversation with the PPI contributors, they told me that it's very important to send a brief agenda maybe 2 weeks before the meeting so they know what we're going to discuss. They have time to accumulate some thoughts or questions perhaps on the area and send a brief summary after the meeting. This is what we covered. This is what happened between the last meeting and this meeting. This is what we're going to do next. Be open-minded. As I said, do try and plan your PPI as much as possible, but there is going to be those informal, spur of the moment opportunities to get really good, rich PPI activity. So do grab these opportunities with both hands. They can be the really, really meaningful, impactful moments. And then consider timing. So if you're in the middle of a lot of data analysis or an ethics application and you can't really give your time to PPI, or you don't have enough done yet to get really meaningful contributions from the PPI contributors, maybe leave the meeting off for a week or two, or maybe a month or so, and really make sure that the PPI is involved at pertinent moments in your project where it'll really make a difference. So I'm just going to hand you now over to Larry.
Good morning. I'm a stroke survivor in rural Donegal. It's not always easy to talk about the challenges we stroke survivors face in life, but I hope that by sharing some of my experiences that I can help others. Surviving a stroke was one of the most physical and emotional challenges, things for my life so far. Although it brought with it brought with many struggles, it also had a lot of personal growth. It is my hope that by speaking up, we as stroke survivors will be able to find support and resources as we discover how this event will affect us for the rest of our lives. I'm ready to speak about the lived experience of stroke as a PPA member. So, my pathway to stroke started back in 2015, and it was a devastating uh, effect on my life. 2016, I call it the La La Land. This was fuzzy. It's a bit like an iceberg. 10% on top and 90% below. So what you see on top, 10%, and what you don't see is 90% underneath. In 2017, it changed me, it broke me, and it opened my eyes. 2018, I lost all the hope of a quick recovery. 2019, I gained confidence in my capabilities and discovered an inner strength, peace, and hope again. 2020, I laid down foundations. That was a marker. 2021, I'm stronger, fitter mentally and physically, and with a renewed sense of purpose and love. I'm ready to speak about the lived experience of stroke. Life certainly is a roller coaster of highs and lows, but just keep moving forward with your head held high and a positive mind. Positivity is very strong with me. You may stumble once in a while, and that's okay. You know, dust yourself down, let out your emotions, and rise again. Uh, Second slide. The my involvement uh, is very much. I believe that being involved in research enables us stroke survivors to give personal perspectives to research, and that has in the past often not been included. I think also it's also important that research leads can include this perspective so that the life experience or the lived experience can be improved and patient knowledge can be helped and help recovery through better understanding and communication. I also believe sharing clinical, medical, and patient understanding of conditions in a medical research encourage better delivery of patient care and recovery. Give a patient voice allows clinicians to understand that the effects of research so that patients and clinicians can work better together to improve the lives of those affected. That's very true. PPA involvement benefits everyone and helps promote good practice and better outcomes for people, but it's also highlighting areas where this does not happen. I live with the effects of my stroke and over the years have been involved in developing services for others, ranging from personal chats and forums with people affected by stroke and hospital wards and in the wider community, developing services locally, regionally, and nationally. Say, for example, different strokes for different folks. I also know that the stroke community well and strive to involve as many people as possible in highlighting the needs of people affected by the stroke through research, participation, promotion, and influence. The importance of lived experience. I'm I'm passionate about involving lived experience in research. I would certainly encourage clinicians to promote patient involvement in all aspects of their services, including research. Patient perspectives and planning services and research are also valuable. I believe by promoting patient involvement leads to successful improved services and research, and so that everyone can benefit from improved health and social care outcomes. The importance of the PPAs to me, why I became involved in research is for a variety of personal and social reasons. They're stated there. Sometimes it's linked to personal experiences of health or community care settings, and my desire to bring about change in the quality of care or to improve treatments either for others with similar conditions. So that slide says a lot from personal motivations, from making sense of the illness, feeling passionate about the issue, having something interesting to do, gaining more access to information, and certainly gaining experience and confidence after a period of out of work due to illness. There's a payment as well, which is good. But on the social motivations, I want to make a good use of their existing knowledge and experience, but the sense of obligation to be a good citizen, giving something back after received public funded healthcare, and finally to be a voice for those who are voiceless. Thank you.